So one of the biggest thing that's wrong with the system is we have a sick care system. We don't, we call it healthcare, but it's not healthcare. When's the last time a hospital or a big clinic talked about your health? They talk about sick stuff. So you have high blood pressure, they prescribe a drug. You have high cholesterol, they prescribe a drug. They don't talk to you about changing your habits, changing your diabetes is a perfect one. Type 2 diabetes, probably, I don't know the stats exactly, but 95%, 99% of all type 2 diabetics do not need to be on medication. They can get off medication by changing their lifestyle. And even type 1 diabetics for that matter, I get a lot of haters for this one, but even type 1 diabetics for that matter, they don't need a lot of the insulin they are told they need if they just eat appropriately. So we have a whole episode on that on our podcast. Episode 1 actually, with my twin brother. His son is a my nephew is a type 1 diabetic, and he talks about how to treat type 1 diabetes affordably. And diet is so important. Diet and exercise are so important. So that's the thing, is that we live in a sick care system. Our system profits off sick people. Do you think our system wants people to be off their high blood pressure medication? No. Do you think they want them to be off their diabetes medication? No. Do you think they want them to have complications of diabetes? Yes, they do. I know that sounds so horrible, but they do, because that's how the system profits.